My presentation is about ADHD, or Attention Deficit Hyperactivity Disorder. It's a neurological disorder which causes inattention, lack of focus, and impulsivity. You might know it as ADD, or Attention Deficit Disorder, but this name is outdated and only describes one type of ADHD. It's one of the most common mental disorders. Most of you probably have friends or know people with ADHD. According to Chad, in 2022, about 3.5% of the population has ADHD, or 11.5 million people. A diagnosis of ADHD is based off of symptoms occurring over a period of time in more than one setting. For example, symptoms can't only be seen at home, or they can't only be occurring at school. To receive a diagnosis, a person has to be showing 6 symptoms of one of the types of ADHD, although they only need to be showing 5 if they are 17 or older. There are 3 types of ADHD. The type that a person is diagnosed with is based on the symptoms they are experiencing. The 3 types are primarily inattentive, primarily hyperactive, and combined presentation. Combined presentation is a little more complicated to diagnose, but I will get into that in a minute. So the first type is primarily inattentive. Primarily inattentive is what it sounds like. Someone with primarily inattentive ADHD mainly has problems focusing, staying on task, and organizing. Symptoms of this type include avoidance or dislike of tasks that require sustained mental effort, being easily distracted, problems with time management, or problems completing tasks, anything that relates to inattention or difficulty focusing. The next type is primarily hyperactive. Again, this type is what it sounds like. People with this type of ADHD struggle with hyperactivity, or basically constant movement. Symptoms of this type include having difficulty staying still in their seats, excessive movement or fidgeting, cutting into conversations, or not being able to wait their turn to speak. The third type is combined presentation, which is basically a fancy term for someone who has symptoms of both the previous 2 types. The diagnosis of combined presentation ADHD is much more thorough than the other types. The diagnosis involves a psychiatric evaluation, complete family and medical history, questionnaires, and extensive questions about the person's childhood, what their education was like, the sort of environment they grew up in. And the reason this process is so extensive is because it's very easy for other neurological disorders to be mistaken for ADHD, such as mood disorders, learning disorders, substance use, and some medications. So, what is the cause of this disorder? Well, the exact cause is not known, although strong evidence suggests that it is genetic, as well as we are able to see sort of biological physiological differences between children who have ADHD and children who do not, such as children with ADHD tend to have less white and gray brain matter. Other factors that have been linked are stress during pregnancy, exposure to substances, and low birth weight. So how is this disorder treated? ADHD is considered chronic, so there is no cure for it, but treatments include therapy and medical intervention. The most common medication is stimulants, which increase dopamine production within the brain. Methylphenidate and amphetamine are the 2 main stimulants, which are used as active ingredients in most ADHD medications. Some examples are Adderall, Ritalin, and Focalin, which are shorter lasting medications, typically about 3 to 4 hours. Some longer lasting medications would be Concerta and Adderall XR, which is just a different form of Adderall, These are longer, lasting about 8 to 12 hours, and they're really good for children who are trying to, stay focused during the school day. But not everyone reacts well to stimulants. So for those who react poorly to stimulants, there are options, namely clonidine and guanfacine-based medications. And what these medications do are they lower high blood pressure. These are very shorter acting than the 3 to 4 hour stimulant ones. And typically these non-stimulant medications require several doses a day. So according to CHADD, children and adults with attention deficit and hyperactivity disorder acronym does not line up. In 2022, about 3.5% of the population has ADHD. I know that doesn't sound like a very high number, but what that comes out to is about 11.5 million people living with ADHD in the US as of 2022. So in summary, you probably know people with this disorder. You might have friends, just, acquaintances, coworkers, and understanding it is just very crucial to being able to understand those people and to be able to have a good relation and to be able to have a proper relationship with them. ADHD is a complicated neurological disorder that people often misunderstand or have an incomplete picture of, and it can be difficult to diagnose because of the way it can mimic other disorders.